for my cardiac assessment, I'm going to need my stethoscope. And I'm going to start by inspecting the patient's chest. The thing to note about assessments that require looking at a specific portion of a patient's body, we want to ensure that we are only exposing the area that we are going to be looking at. We don't want to completely expose our patients for privacy and comfortability. So to start with, I am just going to, let's just say that the donut is the heart. That's a good thing. So I want to just inspect the heart area, noting that if it is a female patient, I'm not going to be able to auscultate over breast tissue or bone tissue, really. So it's going to be a little bit easier on this patient, but I would want to note that I won't be able to auscultate over those patients. So prior to that, though, I'm going to just inspect the area. So I want to note for any lesions, any scars that might be indicative of a surgery that might have happened in the past or recently. I want to note any redness, any swelling, and I want to note the symmetry as well. Then I'm going to move on and identify the 5 places that I'm going to eventually auscultate the cardiac area. So to start with, the right side is anterior, the left side is posterior of the heart. So at the right second intercostal space, we have the aortic area. At the left second intercostal space, we have the pulmonic area. Then at the third intercostal space, we have Erb's point. At the fourth intercostal space, we have the tricuspid valve. And then at the fifth intercostal space, which is more out under the patient's breast, we have the mitral valve, mitral area, pardon me. I'm noting that the apex of the heart is at the bottom and the base of the heart is at the top. I also want to tell you what I am listening for when I'm going to be auscultating here soon. So I will, as I'm going around, tell you the exact sound that I should be stating, but the things that I am noting is that it's going to take me a second to focus and really listen for the sounds. But when I do that, I want to note I want to note the rate and rhythm. I want to note if there's any murmurs or